I'm gonna get going with our introduction to Voy Menopause webinar. Thank you for coming. And the purpose of today's meeting is to really answer common questions on our new service, to go through why we have started Voy Menopause, and also just explain a bit of like our philosophy about care and treating patients. I'm Annie, I'm the director of Voy Menopause, and my like personal passion for menopause comes from the fact that when I was a teenager, my mum had a severe induced menopause from breast cancer treatment. And, you know, she really for like 4 or 5 years just suffered with extreme fatigue, low mood, and not knowing actually what was causing it. And it was only when she went for a thyroid check at the GP that she thought, oh, hold on, this could be because I don't have any estrogen because of the medication I'm taking. And a few days later, she stopped taking that medication. And when her estrogen came back, it was like getting my mum back. And I feel so strongly that like she's actually a doctor, and it took her 5 years to recognize that these symptoms could be hormonal. And I just think there's something so inherently wrong about that. So that's I guess that's why I'm so passionate about menopause and perimenopause as a space that we need to educate women on, help them find solutions that work specifically for them. And yeah, just really made me feel very passionate about solving this problem. So I'm joined today by the wonderful Dr. Sarah Wilson. Sarah, I will let you do a brief intro before we kind of get into the meat of the subject.
Okay, thanks, Annie. Thank you for having me on this webinar. So I'm an experienced GP. I'm working as a GP in the NHS up in the Scottish Highlands, which are very beautiful, bit rainy today, but still very beautiful. And actually, you know, why did I get into menopause personally? Actually, you know, quite in a way quite similar. I started getting menopausal symptoms a little bit early because I'd had some surgery, and I have to admit, I did not recognize them as menopausal symptoms either. I wasn't menopause trained at that time. I started experiencing anxiety, which is such a common early symptom of perimenopause, and I hadn't been told this. I didn't know it. And the more I researched, the more I started to think, it's this and that, and you know, it's perimenopause. So I started training in it, and the more I trained, the more passionate I became. And you know, and like your mum, you said your mum was a doctor, and you know, there's certainly when I trained, which was a long time ago, there was a real lack of training in perimenopause. And so I'm really passionate to get the word out to doctors and to women, and younger women, you know, before they start experiencing their symptoms, as well as those who are experiencing them, what to look out for, what to expect, and you know, and how can we tackle them. Super important.
Amazing. Well, we're so lucky to have you as one of the doctors on the Voy team. And I'm just going to start by introducing, I guess, what we believe makes us different at Voy. You know, we've kind of watched menopause get talked about more in the news over the last 5 years, and there's definitely more knowledge with doctors, and there's some amazing private clinics out there delivering wonderful care, but lots of that is out of reach of women. It's unaffordable, and there's lots of kind of hidden or steep costs that mount up, like extra blood tests, extra consultations. And we just feel strongly that there's a place for a more affordable provider that can offer an all-in-one service so that women can manage their budgets for their health, but also feel confident that they are getting continuous care, proactive monitoring, and have a really, really secure base for their healthcare in this midlife period. We don't believe here that HRT is the only treatment for menopause symptoms. We are a very holistic team, and the word holistic can be kind of bandied around, but to be specific, you know, as part of our plans, you get nutrition advice. We have CBT care as one of our treatment options, as well as kind of HRT, testosterone, and vaginal estrogen treatment. So we're trying to bring all the evidence-based treatments into one place and make it really up to you as a woman, the treatment and the plan you want to make to deal with your personal menopause symptoms. And I think it really is a truly individualized approach to care that we're delivering here. And yes, what we offer is very, very flexible for that reason, so that you can get exactly what you need. Yeah, Sarah, maybe it would be useful if you kind of add why you wanted to join a clinic with that kind of approach.
Yeah, I just find this whole approach so exciting. Firstly, that we're making it a little bit more affordable and more accessible, all in one place. So, you know, having a holistic team that work together, nutritionists, doctors, nurses, pharmacists, all in one place and all working together to deliver this, you know, as Annie was just describing, like a menu of options, you know, that you can have all of, you can have some of, you can pick and choose, discuss with your clinicians what's right for you, you know, and that might just be looking at the lifestyle medicine side of things. That might be looking at your hormones and balancing those with HRT. It might be nutrition. Maybe it's all of those, you know, and just having that menu. There's so much evidence, and and these things can be so helpful, you know, and having that menu to pick and choose what's right for you at the right time for you.
Great. So what I'm just going to talk through is how the service works. And I should have said, many of you have pre-submitted questions. We're going to take at least the last 10 minutes to go through answering those questions. And if you want to submit any questions that come up during the course of the conversation, please just use the little chat icon and submit your question, and we'll try and get to it. So the journey with Voy starts with a 45-minute consultation with an expert clinician like Sarah. The reason for that is we strongly believe that the 10 minutes you get in the NHS is not enough. You need to be able to go through the whole series of symptoms you're experiencing and discuss, you know, any questions that you have about the treatments, any concerns. So that's why we always start with that 45-minute clinical consultation, to really allow you the time to feel heard, to build a relationship with your clinician, and also then towards the end of the appointment to start to kind of create that plan together. Before the appointment, you do submit a very detailed questionnaire, and that's so we've got your full medical history, and that means that you can spend that 45 minutes really discussing, like, what are your priorities, how do you feel, and what are the questions that you have about certain treatments. Sarah, I don't know if you have anything to add, having done our consultations. Yeah, anything to add to that about that kind of first initial consult?
Yeah, yes. So just echoing what you've said, that we do get you to do a what might feel a bit complex or laborious questionnaire, but you know, as Annie was just saying, that cuts your time in. You know, I don't have to sort of not waste time, but I don't have to ask you what you know, what's your weight and your height and your blood pressure and all of those things, because hopefully you'll have inputted all of those, and that cuts to the chase. And then, you know, our consultations are done over video, so you know, we'll be looking at each other on a screen, which is great, because sometimes, you know, I literally hold up products and I say, this is how to use this and this is what we do with this. So it's all online, it's all over a video, and we just talk through what's important to you, what you're experiencing, and you know, some symptoms you might be experiencing, but that might not be important to you to solve. You know, what's important to you, what's affecting your life, and how can we help with that. We'll then talk through options, make a management plan, send you a detailed letter summarizing it all, and do any prescriptions or start any different sort of partner treatments or therapies following that first initial consultation.
Amazing. Yeah. So one of the outputs of one of the outputs of your consultation will be one of our plans. And it's important to say it's completely up to you to choose whether you start your plan after that consultation or not. So we're not locking you in during the appointment to any commitment. You get to make that choice after you finish that discussion. So we have a number of different plans which can be taken individually, or they can be combined to work together. So I'm just going to talk through what's included in every plan and a little bit about the pricing, and then we can move on to some of the kind of more interesting questions that you've asked. So in every single plan with us, you get the following. You get a monthly check-in with the clinical team, and you get access to clinical WhatsApp. And that is really so we don't leave you hanging. We know that women have questions when they start treatment. It's normal. The patches arrive and you don't know how to take them. We want to be there and be able to give you those quick answers, so you don't sit worrying that you don't quite know what to do. So I like to say it's kind of a continuous care model, because you're getting those 10-minute monthly check-ins if you need them, and that continuous WhatsApp. We also include with every plan a monitoring blood test just for estrogen and testosterone. And that's because a lot of people do want to check on those hormones, whether they've started HRT and they want to know if it's working, or if they potentially want to start taking something like testosterone. So that's included but optional, and you can work with your clinician to decide whether you want to use that benefit. Every plan also has monthly nutrition appointments, and the reason that we included this in the plan, again, it's absolutely up to you whether you would use them, is because menopause is a big life change, and actually it does affect your metabolism, and the choices women make with their diet and their lifestyle at midlife really do dictate their kind of long-term health risks. So we really want to give you the option to make lifestyle changes whilst you're on any of our plans, but we are not forcing you to do that. You get your review appointment with your clinician. That's a full 30-minute appointment, usually done around the 3-month mark, and that's where your specific treatment would be reviewed in detail. The reason that happens at 3 months is because actually with all of the therapies as well as the hormonal medications, it can take 3 months to feel the full benefit of the treatment, which is why that's when that review happens. It's not to say loads of women don't feel benefits much earlier than that, but the kind of standard and evidence-based clinical pathway is to check in at that 3-month mark, and we're practicing evidence-based care. So there's a number of different plans. There's an HRT plan which starts from £86 a month. There's a testosterone plan which starts from £90 a month. There's our CBT plan, which is £99 a month, and you get 2 CBT appointments alongside all of the other benefits I just mentioned. There's our weight loss plans, which are through Voy, obviously. We have a weight loss service, which is the first service of the Voy brand, and so you onboard onto that service as part of getting those medications. And we also have vaginal estrogen and DHEA treatments. Those are usually part of a broader treatment plan. So they're often prescribed alongside other medications, but they start at £15 a month. So that's the kind of nuts and bolts of how our plans work. And Sarah, I don't know if there's anything you wanted to just add about common combinations or anything like that with our plans.
Yeah, so everybody's going to be a little bit different, aren't they? So some people are going to come to us maybe having even started HRT and wanting a review of that, or am I taking the right thing? Can I change it? Can I change my dose? Some people will be completely new and just want to talk through whether to start something like HRT or one of the other therapies. So yeah, lots of different choices on the menu and combinations. So estrogen, would be used in combination with progesterone if you still have a womb, if you haven't had a hysterectomy or anything like that. So that's the most common standard HRT. Some people would add testosterone to that after a discussion, with their clinician. And if you're having experiencing symptoms of vaginal symptoms or urinary symptoms, then those vaginal hormones can also be really helpful. And some people would opt to take those just on their own, you know, because that's the only symptom that they want to. So going back to the word menu, there is this menu, and you can choose little, you know, bits and different combinations, and that's all fine. And that's what we're here to talk you through, really.
Perfect. So the last thing I'll say about sort of how it works is that, yeah, the plans are 3 months, and that gets you to your review appointment, which is included in that 3-monthly price. The reason we charge monthly but have 3-month plans is just to spread the cost of getting care. We found that makes it much more affordable and manageable for women. So that's why it works that way. And you don't auto renew on our plans. So there's no kind of sticking on a subscription when you're not actually using the service. You would, after your review appointment, if you want to re-engage and reactivate onto your plan with us, you would opt in and choose to do so. So that's just some really common questions that we get about cancelling, management, the monthly charges. So we've had a few FAQs, and I'm going to jump into those now. I'm going to ask Sarah the questions because I think they're mostly kind of clinical or questions about how HRT works. One thing I should say before we jump into it is all our advice, we can only give kind of general broad brush statements to clinical questions. Obviously, specific personalized risk and benefits can only be analysed in an individual consultation. So none of this is actually direct medical advice because we can't give that on this kind of webinar. So just to caveat that we're giving general advice at this point, and then we'll jump into questions. As I said, please use the chat if there are any other questions that you want to ask. So the first kind of very common question that we had submitted was, how do I know if I need HRT, and how long would I be on it?
Yeah, so that is a really, really common question. And, you know, like we were touching on earlier, when you're starting the perimenopause, and just to define that word, by the way, so menopause, that's your very, very last period. Perimenopause, that's the period of time from the first change, which might be a symptom or a change in your period or a hormone change that we measure in a blood test. So the perimenopause is your first change to your very last period, and then your postmenopausal period is after that. And all of these times you might have menopausal symptoms, but early in the perimenopause, symptoms are subtle, they're kind of creeping in, they're just changing. You might not realize that things are happening, that things are changing. So it's really difficult to know. And that's where questionnaires like the, you know, symptom questionnaires can be really useful, because you can sort of, you know, like the one that we get you to do, and you can really look at those and think, oh gosh, this is a menopausal symptom. You know, not just hot flushes and sweats at night, it's anxiety, it's what we call brain fog, it's you know, dry skin, dry hair, vaginal changes, aches and pains, joint pains, those sorts of things. There's all sorts of symptoms. So it's looking at all of your symptoms as a whole and starting to think, oh, you know, am I starting to get some perimenopausal symptoms? And then would HRT, of course you don't have to go onto HRT, but you might want to, because it will help with these symptoms. It's the you know, it's the one thing that's proven to help with all of these symptoms, and it gives you health benefits for your future health as well. So it's definitely a conversation to have with a clinician.
Yeah, exactly. And just briefly, what are some of those kind of longer term health benefits if people did go on HRT?
So we know that starting HRT in the perimenopause or within 10 years of your menopause gives you lots of really good health benefits. And those are for the cardiovascular system. So reduced risk of things like heart attacks or other cardiovascular disease. Your bone health is really super important. So we know that keeping hormones up at a good physiological level helps you keep your bones strong and reduces your risk of osteoporosis. Osteoporosis later on can give you fractures, and we know that actually if you have a fracture from osteoporosis, then that carries a real health risk a mortality health risk. Lots of people might die after a fracture. So reducing that risk is really, really important. It reduces your risk of HRT, which can reduce your risk of type 2 diabetes, bowel problems such as bowel cancer, and maybe dementia as well. So, lots of really good health gains.
Amazing. And I think we don't talk about them enough because we often talk about the risks, right? And we've definitely had a few questions about the risks of HRT. So I'm gonna combine them into one question, Sarah. So question one, which I think you'll be used to, is, does HRT cause cancer? Does it increase the risk of cancer? And can you take it ever if you've personally had breast cancer?
Okay, so stop me if I whittle on for ages and talk for too long. But I think, the short answer to all of that is no, it doesn't cause cancer. And I'll kind of explain what I mean. So on the whole, mostly nowadays, when we use HRT, we use body identical hormones. And by that, I mean the molecule of the hormone is exactly the same as the hormone that you make in your body. And physiologically, it doesn't really make sense that a hormone would cause cancer in your body. Cancer is caused by a change in the DNA of a cell that makes it everlasting and turns it into a cancer cell. And there's lots of checks and balances along the way that stop that from happening. And so in order for a cell to become a cancer cell, it has to have little mutations in all of those checks and balances. Now, every single cell in your body has got hormone receptors on it. And when you develop a cancer, mostly they will also have hormone receptors sitting on the edge of the cell. So breast cancer is the one we're talking about most, isn't it? So say you have a breast cancer, and most breast cancers will have hormone receptors on the cells because every cell does. And what we know is that hormones, your natural hormones, and HRT and the pill, for example, might make that cancer grow faster. So grow from a single cell of cancer into a lump that you can feel, or one that can be detected on a mammogram faster and sooner. That actually might not be a bad thing, because it might be picked up and diagnosed earlier. But we know that hormones might make any cancer that's there grow faster and be detected. So that might be why we see an increased incidence of breast cancer diagnosis when people are on hormones, because it's actually it's just showing up a bit sooner.
That's really interesting. I've actually not heard it explained in that way before, which is really nice, Sarah, of like the difference between something causing the cancer, which I think is the common stuff that's in the press, isn't it? And then actually that it makes cancerous cells that were there grow, and then it can be found more. So that's a really useful explanation. Thank you.
So there might be this increased incidence or increased diagnosis of breast cancer on people taking hormones. Now that's shown more when we use what we call like sort of synthetic progestogens in HRT. Nowadays we have a body identical progesterone that we use, which seems to be much lower risk.
Amazing. So to summarize, you would say it doesn't increase the risk of breast cancer or cause breast cancer. And is it fair to say that although it's less common to prescribe it to women who have had breast cancer, that would just be a very individualized consultation for someone who was interested in it that had that?
Yes, absolutely. So if you have had breast cancer and you're suffering from menopausal symptoms, now this is a conversation to have with a menopause specialist who really knows the risks and the benefits. Because as I was saying, if there are any cancer cells anywhere left in your body, which obviously we hope there aren't, HRT might encourage them to grow faster. So it's a really in-depth conversation to have. There's alternatives to HRT that we can talk through first, and we usually go with those first line. But that doesn't mean that HRT is absolutely out of the question. If you've explored all of those alternatives or tried them or don't want to try them, it's a nuanced conversation and a decision to make in partnership with your clinician.
And what I should say is with Voy, if that's something you're interested in and you have had a personal history of breast cancer, we would make sure that all of our doctors have additional training in women's health, additional training in menopause, but we also have a few advanced specialists, and we would make sure that you see those people to make sure that you can have that individualized conversation. Okay, a couple more on HRT before we move into the world of weight loss. So 2 more questions about the risks. Does HRT increase the risk of blood clots? And does HRT change either way, positively or negatively, the risk of dementia?
Okay, so let's do blood clots first. So we know that when you take estrogen as a pill, it can increase the risk of blood clots. And that's because when you take something as a pill, you swallow it and it goes from your intestines into your bloodstream, and it passes first through the liver, and the liver is in charge of clotting. And as estrogen passes through the liver, it can increase your risk of blood clots. So things like the pill, for example, increases your risk of blood clots. Now, mostly when we prescribe HRT, we prescribe estrogen through the skin. So that's called transdermally, or through the skin. And that means it goes straight into the bloodstream through the skin. It doesn't go through your gut first or your liver first. And that means no increased risk of blood clots whatsoever. And the body identical progesterone that we generally use is taken as a capsule, but actually also doesn't increase the risk of blood clots. So old-fashioned HRTs, which were taken as pills, yes, they do increase the risk of blood clots, but the stuff that we use nowadays, no.
Great. And what about dementia?
Right, dementia. This is a bit more difficult to answer because there's just less data out there available. It's talked about a lot in the media, but the data is really conflicting and it's really not perfect. It's very, very difficult to do a perfect study about dementia and HRT because you would need to start it when people are in their late 40s, early 50s, and finish it when those same people are in their 80s. To look at dementia risk, and to do a very good quality randomized control trial for 30 odd years is almost impossible. So there's not much data, and every time somebody comes up with, oh, here's a paper showing that there's a dementia risk from HRT, we can show them another study showing actually there's an improved risk with HRT. So if you're looking things up on Google, it's really conflicting, it's really confusing. What we can tell you is that dementia seems to be about twice as likely in women as it is in men, and that coincides with menopause and when we lose our hormones. And there is certainly some data suggesting that body identical hormones might reduce the risk of dementia. But
it's early days, isn't it? It's early days in terms of...
It's early days. There's not much data, but again, body identical hormone physiologically, it's just keeping it in physiological levels. And there's as much data to saying it's good as it's bad, and there's definitely data saying that it reduces your cardiovascular risk and your risk of diabetes and your quality of life, which probably then makes you more likely to lead a healthy lifestyle from nutrition and a movement point of view, which definitely reduce your risks. So again, it's a nuanced conversation.
Great. Okay, so last, I'm going to cover 2 myself just because they're quick to cover off. So one is, do you need a blood test before starting HRT, and does Voy offer a blood test? So in general, the answer to this is no, you don't have to have a blood test before starting HRT. Blood tests aren't diagnostic tools generally for women in the perimenopause if they're over 40. But if you want a blood test, of course, you can have a blood test before, and there's absolutely nothing wrong with that. We do offer blood tests through Voy, but it's not the standard starting pathway at the moment. If you're interested in a blood test, please reply to one of our emails and we're happy to arrange that for you. The second kind of nuts and bolts question was, does the service work for women who are in surgical menopause? The answer to that is absolutely yes. So I'm going to give you the last couple of minutes, Sarah. We started a minute late, so we'll run a minute over to just ask you a couple of questions about HRT and GLP-1s, because quite a lot of people had questions about how do these medications work together? Do they help each other? Do they get in the way? And is there a best GLP-1? Probably people are thinking Mounjaro or Wegovy for people who are on HRT.
Right. Again, this is probably understudied, and well, you know, because these medications are relatively new, but I don't think I know of any evidence about which one to use specifically if you're in the perimenopause and menopause, or if you're on HRT. But I think, you know, there's definitely anecdotal evidence about these GLP-1s that some people respond to one better than the other. And that's something to talk through with the clinicians at Voy. You may find one's better than the other for you, and I don't think that's related to whether you're on HRT or not. They don't get in each other's way in any way, shape or form. The only way that they can affect your HRT is that they might affect how we absorb oral medications. So if you're on a progesterone, which you take as a tablet, at the moment, most guidelines are saying to increase the dose of that progesterone just to make sure you get adequate absorption.
Yeah.
So that's something to talk through with your clinician who prescribes your HRT, and just make sure that you're on an adequate dose, or the safe dose. I don't think they get in each other's way in any other way whatsoever, and I would imagine, you know, that they'll just work synergistically. HRT does not magically make you lose weight. You know, we know that menopause can make you gain weight, or you know, weight gain is more common in menopause. HRT doesn't seem to reverse that, sadly, but it does help with your energy levels and your motivation and your well-being in general. So it means when you start HRT, it's a really good time to look at your lifestyle, because you're probably going to have that motivation and energy to actually really address those things.
Exactly. Yeah, and again, that's one of the reasons why we do include these optional nutritionist appointments as part of every plan, because actually when women start to feel a bit better, potentially because they're on hormones or they've started their CBT, they then do want to make other kind of proactive lifestyle choices that help them have more energy and feel better. And that's what we're really all about, as women kind of living in good health for a longer time, and that's what we're trying to achieve here. So thank you very much for joining today. If you have any questions we will that we didn't answer, we will send a follow-up email to this. Please feel free to send a question back, and yeah, we're very happy to answer them as the team. And yes, thank you for joining today, and we'll be doing more of these to introduce the service with our other doctors, so please do keep in touch. The next one is going to be specifically on weight loss, weight gain, and menopause. Thanks, Sarah.
Thanks. Bye-bye.
Bye.